This is Harry, an 83-year-old man. He and his wife Gloria live in a double-storey house in Broken Hill. Harry used to be a miner and now owns a souvenir shop. They have one son, Ron, who lives in WA and comes to visit them every year. They also have wonderful friends and strong ties with the community in Broken Hill. Unfortunately, 15 years ago, Harry was diagnosed with Parkinson's disease. As a consequence, Harry's speech is becoming very difficult to understand. His memory is deteriorating and he tires easily. He has muscle rigidity, moves very slowly, and feels constant pain. Sometimes he has outbursts of unprovoked anger and sexual behaviour. He feels frustrated and isolated because of all this. They do get help from home care nursing and staff, with cooking and cleaning. Neighbours supplement this between visits. A social worker investigated funding for Harry's home care package, which was left unfinished. Regardless, Harry requires assistance for most activities of daily living. Despite this, Harry's condition continues to deteriorate whilst Gloria struggles under the demands of caring, often feeling burnt out. This has become more apparent as Harry has been admitted into respite care for the third time this year due to an elective colonoscopy which Gloria will be undergoing. On top of this, Gloria also battles with her own health problems such as heart disease and so is not able to lift heavy things whilst often experiencing shortness of breath. This has proven difficult when helping Harry with his transfers from the wheelchair. Their son, Ron, wishes for his parents to move into a nursing home near him. Although they are struggling, both value their strong social ties within the community and their independence. Harry's multidisciplinary team currently includes his GP, physiotherapist, occupational therapist, speech pathologist, dietitian, pharmacologist, and social worker, who are working together with Harry to develop a set of goals for them to work towards and assess over time. For example, Harry identified some of his goals to be being able to talk to his family and friends, eat a meal without choking, reduce pain, and stay at home with his wife. The healthcare professionals then help to break these down into short-term goals, such as to improve speech clarity, reduce the risk of aspiration, and optimise pain management. They also had a discussion regarding the plausibility of his wish to stay at home with his wife and what that would mean for each of their well-being. From this, they developed a plan that catered to their needs.
The main role of the GP will be to contribute to the team care plan. Firstly, Harry's medications need to be reviewed and he needs to be started on a Webster pack. Consideration should be given in ceasing lorazepam and prednisone due to risk of osteoporosis and falls, and reviewing his antihypertensive medication. Adequate analgesia should be prescribed. Harry's GP should also refer him to an ophthalmologist for his macular degeneration. Ongoing follow-up is important to monitor Harry's decline and screen for depression.
The physiotherapist's role in Harry's care will be to maximise independence and functional potential, reduce the risk of falls, manage pain and reduce secondary complications. Cueing exercises and breakdown of complex daily activities will assist in maintaining Harry's functional independence. Trunk rigidity, muscle weakness and reduced postural control need to be addressed to reduce Harry's high risk of falls and facilitate safe transfers. These factors can be addressed through muscle relaxation strategies, balance training and high-intensity strength training. Aerobic training will also address secondary cardiovascular degeneration, while stretching and positioning will aim to prevent secondary contractures.
Harry's coughing during meal times is a cause for concern for the speech pathologist as it puts him at risk for aspiration pneumonia. To manage this, Harry will be asked to try a different diet, minced and moist, that might be easier for him to swallow. The dietitian will ensure that Harry's nutritional needs are met. He would also receive a speech and communication assessment, followed by LSVT therapy to assist with the clarity of his speech in the short term.
Harry's social worker extends her concern to Gloria's well-being as a carer. It is recommended that Gloria attends weekly lunch clubs facilitated by the Community Council to connect with other carers. Based on the couple's current position, it would not be ideal to move to Western Australia as both familiarity and strong social ties are important factors within their lives and with the onset of Harry's dementia. From this, it is recommended that the couple follow a regimented daily plan to ensure consistency, enabling them to navigate this process smoothly. It is advisable that Harry moves into a nursing home within Broken Hill as a medium-term goal due to the progression of his condition and the level of care required. In the short term, the couple should apply for the National Disability Insurance Scheme to get additional funding for daily activities prior to this transition. Harry's multidisciplinary team hopes to work together to improve his quality of life.